All right. Hello, everyone. Welcome to the stream today. My name is Nick Zupan. I'm the epidemiologist with the Rock County Public Health Department. We're going to go ahead and get started with our Numbers with Nick segment for today. So as we go through the content, if you do have questions, you can put those in the comments section and we'll try to answer the questions at the end of the video if there are any questions that come through. And as always, you can reach out to us via social media if you have questions after the stream or after you view the recording of this video. So what I have on the screen today is the daily snapshot that we share on our social media pages on a daily basis. And the reason that I have this kind of displayed is we're going to be making some changes in how frequently we post this information. And really the reason is that the state provides us with this information and we subsequently report it out on our social media channels. And one of the changes that they've implemented at the state level is they're trying to push out this data more quickly in real time. So you may or may not have seen previous communication from the health department when we say that there are, for example, today there may be 16,478 total confirmed cases of COVID-19, and that's an increase of 4 since the 14th of July. But that doesn't necessarily mean that there were 4 people who tested positive in that 2-day time window. That just means that we received the report at the health department through the state of 4 additional people testing positive. And generally speaking, these are people who have tested positive over the course of the last week or the last couple weeks. And this lag time really is due to when the person goes and gets tested, there's some time that it takes from when the test is collected to when the test is kind of determined to be COVID positive. And so what we're seeing is there is a substantial lag, or there can be substantial lag in terms of when we get our information at the health department and when a person actually tests for COVID-19. Now, the complicating factor in all of that is sometimes the tests are inconclusive or they're not readily counted, or there's some kind of variation in the testing results. And we do take a little bit of time to clean up our data as we receive it. And so what the state has now done is to reduce some of the lag time between when a person tests and when the results come in. They're reporting that information kind of immediately as they receive it before they go through and do some of the data cleanup that is necessary to ensure that we're counting what we need to be counting in terms of our negative results, our confirmed results. In most cases, this change hasn't really affected the confirmed result counts on a daily basis. So the increases that you see on a day-to-day basis are fairly consistent, and we're not seeing, the number of positive results go up one day and then go down the next day and go up the next day and go down again. But we are seeing that with our negative case results. And it's probably confusing to those of you who have been following us for a while, because for the most part, we have been reporting only increases in the number of negative test results, but only recently, since the state has implemented this change, this number that you probably are familiar with in terms of the daily increase has sometimes been 0 because there have been fewer negative results or no negative results that we've seen on a day-to-day basis, and the numbers are fluctuating quite a bit. And so what the state has recommended that we do is switch to looking at the increases over a 7-day period. So that's the first change that we're going to be implementing with these daily snapshots that we had been producing every day. What we're now going to be doing is change the frequency of how we provide this information. So what we'll be doing, instead of a daily snapshot, you'll be seeing the snapshot released on Tuesdays and Thursdays, and it will include information in terms of the increase that has happened over the past 7 days. And like I said, this really is intended to smooth out some of the variation that we're seeing in the negative test results that are coming through, where some days there are more than the previous day and some days there are fewer negative results in total than the previous day. So I pulled up the document, the snapshot that we regularly produce. And again, this will be going out starting next week. We'll be on a schedule of Tuesdays and Thursdays, posting this to our social media channels. So as always, you'll see the date in the top right portion of the screen. You'll get the number of active cases, and this is based on information that the health department has in terms of who has tested positive recently, who is still symptomatic and capable of spreading the illness to other individuals, and who has recovered from their disease. You'll see on the left-hand side of the page, you'll get the total cumulative number of negative results that we have been reported or gotten reports of at the health department. You'll also see the cumulative total of the number of people in Rock County who have tested positive for COVID-19 over the course of the pandemic. You'll see the total number of deaths that have occurred due to COVID-19. And then we will also include the total number of residents who have completed the COVID-19 vaccine series. So those numbers won't change in terms of how we're reporting them. You'll continue to see those a couple times a week. The change that we're implementing here is the number of increase over the past 7 days. So prior, we had been reporting the daily increase on a day-to-day basis, and now we'll be looking at the increase over the last week. So on Tuesday, we'll be looking at the past 7 days, and on Thursday, we'll be looking at the past 7 days from Thursday. So you'll get a couple different weekly changes, so you can see how those numbers are changing over the course of the week. And if you're tracking those over the course of time, you'll see if the numbers are going down or getting higher and that kind of thing. But basically, you'll see the total number of new negative test results that have been reported to the health department over the last 7-day period, the number of positive lab confirmed results that have been reported to the health department over that 7-day period. We'll also be reporting deaths and the number of fully vaccinated residents over that 7-day period. So these numbers just kind of give you an example. If we had pushed this out on July 14th, this is what you would see in terms of 7-day increases rather than the daily increase. So we wanted to make everyone aware of the change and why we're making that change. Again, it's really due to the data quality and the data cleanup and trying to reduce some of the lag time in getting information to the health departments. And in doing so, it's caused some confusion and some complications for reporting daily changes. So we're moving to a weekly, looking at our totals on a weekly basis. So that's just the piece of information that we are providing via social media. And so we've heard from some members of our community that they're a little bit concerned about not seeing this information as regularly on social media. But what I do invite everyone to check out is our Rock County Public Health Department page. So as you navigate to co.rock.wi.us/public health, you'll see a COVID-19 icon kind of front and center. You'll click that icon, and then I'll show you what happens when you click that icon. You'll come to this COVID-19 Coronavirus Disease 2019 landing page. And we will see a variety of different data pages or pages that you can explore, including the data page. So you'll click there, and we have a variety of different reports. And I know we've gone through this in previous live streams, so I won't go through this in great detail, but if you are looking for information on the daily change from one day to the next, the report that's at the very top here, the Rock County and Wisconsin case information, it's updated every single weekday. So Monday through Friday, we're continuing to update this, looking at the daily increase in terms of case activity in Rock County and Wisconsin. So I'm just going to open that page up so you can get a sense of where to find the daily increase information if you're still very interested in getting that. So at the top, we have the table of the number of new cases that have been identified, including the total numbers that have been identified in Rock County. And as we scroll down, we have a graph that shows the daily increase in the number of cases. So the numbers are a little bit harder to see in terms of this graph, but you'll get a good sense of the trend and what direction we're heading when you take a look at this graph in the middle of the page. So the red bars are the number of new positive results that are being reported to the health department, and the black line is the 7-day moving average. So this basically looks at the total number of positive results that we've received over the past 7 days, and then divided by 7 to get a sense of how many new cases we're seeing at the health department per day over the last week. Again, this you can see as we look at the red bars, they tend to vary quite a bit. It depends on when our labs are testing and operating. Also, we're seeing fewer people testing on certain days, potentially Fridays and Mondays. So we see a little bit of variation in the number of new positive results that are being reported to the health department. So that 7-day black line really helps us smooth out those trends and take a look at where we're heading. And right now we're heading in a great direction in terms of our COVID-19 case activity. I think just recently we've had a slight increase in the number of cases, and that's in part probably due to some of the activities that happened around the July 4th holiday. I know that it's an important holiday for many people, and getting together with family and traveling, whether it's in the state or across the country, is a pretty common activity. And so when we have something like that happen, we're bound to have more case spread just because people are more exposed to different individuals, and the virus has more avenues to spread from person to person. Although, the numbers are still remaining fairly low because of our vaccination rate, and things are looking positive despite a small increase that we've seen most recently. The other piece of information that's probably causing some additional spread here in Rock County as well as in Wisconsin is that the Delta variant is more infective and potentially could cause more severe illness among unvaccinated individuals. So people who are unvaccinated are at higher risk to contracting the Delta variant of the COVID-19 virus. And we definitely are probably seeing some spread related to the Delta variant, definitely in Wisconsin and probably in Rock County. So we know the Delta variant has been identified in Wisconsin as well as the southern region of Wisconsin, of which Rock County is a part. We haven't had the official communication that the Delta variant has been identified in Rock County yet, but it's pretty reasonable to assume that given the holiday, the spread across Wisconsin, that it's pretty reasonable to assume that the Delta variant could be spreading in Rock County as well. And so although we may see some ongoing increase in spread, I'm really encouraging everyone, continue to encourage everyone to get vaccinated. Talk to your doctor if you have questions about the COVID-19 vaccine. And the vaccine is really going to be our pathway out of this pandemic. And despite the Delta variant that circulated, we've seen that the vaccine continues to be effective against that Delta variant, especially in preventing people from falling severely ill. So with that kind of sums up the changes that we're going to be going through and that you'll be seeing next week, starting next week in terms of that daily snapshot. We're moving it to a twice a week snapshot of the COVID-19 activity. If you want to see more information on a day-to-day basis, again, I invite you to check out our website and take a look at the reports that we have there, especially this report that I have up on the screen, which is updated every single weekday. So with that, I'm going to check the chat box to see if we have any questions that have come through. It doesn't look like we've had any questions. So with that, I'm going to close out the stream for today. Thanks everyone for joining us, and we'll see you again in a couple weeks. Thanks.